ene International Day for Persons with Disability. You know mama did them. Ene your mother. Na minim say wukui kwa ye yesi wa ye de kan won mu a wo mu adidam asem anase didi wo mu ho adwuma. We are advocating for persons with disability e wo man. Oba oman Ghana mu a seni hu ye nuanu mama didam. In your view, because money on money adwuma in your view.
Happy FM
And be as frank as you
98.9
can with a year atiefo nyina.
Okay. Yo, me da se bebre wa akunya modia amayen. Na de edi kan no me cha wetiefo na afei nso so no maka say dwumedi amudi dwumapa e wa ha.
That's it.
Na sembisa obisa ye no na mmoaya me de be ma ne say ya kano to be frank
Persons to be frank.
To be frank, persons with disabilities, medi them no. Sabi, ye maya ye wo mu yi, nyema bebre enkoso momo. Na senia sabi omusi tie wa bonten kra no, eni ankofo de hwe omo. Ene senia ankofo esi ehu omo fa no krampo no, eya demu. Na ye beka say even the institutions kra na ye yesi go say ankomo nhwe say niema saa be koso krampo no. Atodi bi nso so a aya na niema atochima kakra. Na we ne mami nya antiase say even obi ewo Parliament House or contact me or person me review the act for them. Na there are so many gaps in the act, so many gaps. Na o compare senia abochire ene Ghana city na aya na otimu say yakechire kakra. Na yenim say as time goes on we bonya mempaye say obeboa na niema ato na akwemu. But to see ade yehwa in fact omo medi dem no say bi omo bre ene ne mebebre wo no ma enkoyi mo.
Eden na omo bre.
Oh, say
and ema ben na enkoyi emfa mo.
Okay, internet yehwe no say may you sue ade efe no community based rehabilitation matrix.
Okay.
Akwai say map bi. Ti e ka apomodin health apomodin a. Baby wo no ma omo nya akonya enko hospital enko somo yare. Na we baby say adentina omunti nyo akonya na enko somo yare.
Happy FM 90.
Number 1 sikasem. Number 2 building na esi won dan na esi won yaresa beyond dan. Eno ankasa cramp no enya accessible. Ena number 3 waiting time. Sebi ye wo se yenya ade bi a eno no emma omo medi dem no privilege. Omo kwa akogye yaresa wo se etimi hwe omo ntem no moko. Nanso ebe wan say obeko hospital no mu delay so.
Yeah.
Yes, they are on the queue.
Yeah.
So they can go there as early as 5:30 a.m. If you be crack do very, very early. But no, you say Dr. Mai.
They are not part of the priority list.
Exactly. They are not. It's a man is an ometwen obebe fi na dia asa. Na car kra obefa kra transportation, obefa de free fee alcohol hospital na krampo no. It's not accessible. Na driver for bebre so no omo mpese se bi ombefo omo. No bi so be na adwun so obefa no so no obeji wa boarding. It's the distance from where you are picking the car to the hospital is just about, let's say, 30 cities. Obeji 100 Ghana. It sounds okay wheelchair because ono feel say oye wo mwa. Ne mom no ni refi say eye djuma no oye.
Yeah.
Now so the fair na also oje no onye wo sa because we did them into be double no. Adenti na also the wheelchair betra me kemu. Adenti na anu so betra me kemu. Obi anya na mesi me ye dia meje 100 Ghana cedis. Obi anything. E wo so utua. But these are the people who don't have money. Well, into that the health aspect. You ban education in so on muso so no adding. Bebre wo hono ma se bi o ma frame aka o ma sem say don boko eco school na o ma say ye hia nkola we wa ha. Yes, meanwhile there has been an implementation of the inclusive education
system, of course.
Oh, but bebre no because most of the schools you get there and you'll be shocked how even the teachers, even the proprietors, welcome persons with disabilities.
Which is against the law.
Exactly. They will tell you point blank, we don't have this here. Why? Because, number 1, some of the schools are lacking experts to even cater for the kids. And the perception that has been created in our system, it's say, ono no de neba eba school na ye je neba no tumu a Only akwa ne ba no di dem no say, akwala bi say what school ma dem ba no ntimi ntena ha. And they may be free. So remember that the school is running based on profit. And to no who say, so parents do na aka say akwala wo school ma ntino me ba dia. Then I just say, oh ma ho kwan krama akwala ni mba school mo. So they end up dejecting the children. And that is also something that they are fighting with. Education. Sometimes, obi obeje won so no, just say like I said, expertise in you. So obeje won so no, a dining accessible. It becomes difficult. Education is also a problem.
Is it that and I mean, have we deliberately decided say act noa ebo yinu mo ni edem ho ebra and as a protect home. Ya shada any empathy de bidi djuma asomaya na.
And tisa act is a fantastic act. In fact, it is very good. It is solid. Implementation, reinforcement, and a problem. It's an say, yen shanning kitten say, I was so obia di banana so. Sani asebi, you were jume. Mijidi said there are code of ethics governing the work you are doing.
Yes.
It is a code of ethics now. Whoever is in charge here, your boss, will have to penalize you.
Okay.
But in this case, Abane say, act no. Now, so implementation, no also shane kitten say it was so be disono. They are not available. Even if they are not even at work. Your shared federation of this disability organizations they are responsible for that. Your shared National Association of Persons with Disabilities they are also there. But how are they ensuring, say, their act can go for edimujuma? So people are in their various places do their own thing. They are doing their own thing, and nobody can question them. And I was saying accessible. But it's against the law because there is something called constructive ethics. Even a Daniel BC, there are ethics, code of ethics that is supposed to govern that. But where are they? Exactly.
And the governments that we've had over the period, do you find them say they are interested in matters in
fact, in terms of the governance of previous government and the current one, I know say they are making effort. Okay, they are making effort. No effort, they can do better. They can do much better. Why do I say that? Because even if petitions are being subjected or it's being presented to people in the Parliament House for them to increase, in fact, Ube who say, I'm not a politician. I'm not a politician.
Yeah.
Now, say the toll booth that was created, persons with abilities were those people manning the toll booth.
True.
Because they are immobile.
True.
Because, yes, so that is a place for them, a station for them. Now, you came in and you said, oh, there is a new think tank system, so let me change this. But the plan is that, make sure, say, there is an accessible job available for them.
There should be an exit plan.
Exactly. Exit plan. It's you give them that exit, that plan. But in this case, the man is a baby fee. Until you ask yourself, putting it on the scale, because it has added up to the unemployment.
True.
The percentage, it has added up. And now you'll be shocked, say, that same money is what they use to protect or to even take care of their families.
Because so they are getting economic empowerment from a year.
Exactly.
Yeah.
It's at the end of the day, they also contribute their quota because anything they buy, they pay tax.
They pay taxes, of course.
Yes. So whichever way, where you free, now they are home. They are jobless. And they even have to come out and fight for the wages that is due them. You see? But recently, now, I think just this week, when I say Federation of Disability Organizations, they were agitating on something. Our said they should increase the percentage that has been captured for them in the budget. Right.
And the District Assembly Common Fund.
Yes.
Yeah.
So I'm sure their plea will be heard by the government. They are doing their best, but I think the government can do way better
than what is currently prevailing.
Exactly.
Because I know you probably might have done extensive observation on Emrano said the AD Nijuman, and you were mentioning of some gaps that you have realized there were Emrano. What are these gaps?
Okay, so
some of them we may not be able to exhaust all of them.
Yes. So you see that first and foremost, let's put this in our head. You only appreciate the gaps when I speak on this matter.
Yes.
Everybody is subjected to disability. Obibia, nobody is exempted. Whether you are rich, Obibia at any time. And Osho Unsu ye krana can say old age will catch up with you.
Yeah.
And definitely you'll be disabled.
Yeah.
Because at the end of the day, you would immobile at a point and you need assistance to do certain things. Now, what are some of these gaps? Gap maybe say Yashemra say, oh, every organization must have, it's a must, must have a percentage to employ persons with disability. It's a must.
And that is in the law.
It's in the law.
Yeah.
But you go to organizations, there's not even one persons with disability. Unya bakumpo. Now maybe say impo happy is there anyone?
Oh, can any obi? Can you be?
And can you come the mamo here?
Paul and Okode.
Oh, okay.
Yeah.
Right. But it's no more here.
Yeah.
Okay. 18 on. There should be that kind of privilege. Ebanesana eti unemployment neso. But in this case, entesa. And it is also mandated. Say, ejumebia any social place, social facility biya. Baby biya will be ana. It was say omma bibi a friend reasonable accommodation. I actually say you have to adapt. It was say uye ne mebia ebema oni akunu wedi dem obetima ye ejuma. E wo baby a also woye. Etini say yeba muhanu mu say ana baby a also ye ejuma na say hono enye friendly a hono mu ano a. E was say ni wura no edan ne dia no. Also bibi a actually say why or the akonwa bia toto won mama oni akubitima ye ejuma. And no say no so another gap because we can't find it. Obi won no moko facility or say na mesi me dan wi act ya ben 2% kire me say me bubu ade we nyina sika sem o ntimi nye. Again, the enforcement agency no omo we. They are not. Send your town council any AMB echo round echo check even GRE omo call round for taxes kasin konfo no. If we should have such people on the ground working massively, I believe say ankasanima we nyina no sebi we will be able to cap some of these gaps. But it's a problem. Well, I will just talk about this few one. Even at the hospital, the health sector, it's also another thing. Tebane sana na aya ama fairness apomodino access to healthcare no na aye bibi ho. And it is really sad. It's very, very sad.
Ofa Emrano, and this I'll try to summarize them.
Yes.
Because Yakasi come run one after the other. PWDs have the right to family life, social participation, and non-differential treatment in residence. Said your boss one. Prohibits exploitation, discrimination, and ensures PWDs can be parties in judicial proceedings.
Yes.
Penalty for contravention, a fine up to 500 penalty point units or 2 years imprisonment. They say, Sanima Winano, Ubu Eswa,
yes.
Now, when we are talking about access to public places and services, there is a mandate Embrano Ediaba say we should make all public places like buildings, roads, and services accessible to persons with disabilities. Libraries, airports, residential areas.
Yes.
Airlines must also have, in the emphasis for purposes of transportation, I will say, Unya Bia Edima persons with a disability.
Yes.
Say, when it's what, and also a now, employment and vocational rehabilitation. There is an established employment center. I was say a Jumai for Ahodro to me called okay. We were specific skill set we meet me I employ as a person with a disability. And also do one yadia employees do one a day. One more a So it is quite clear, obvious. Say Embrano.
Yes.
But said your work because we do not have an implementing authority.
Exactly.
Our beshe say Embrani bit media dijumano. That's why we happen to see them in a situation they happen to find themselves in.
Absolutely.
So therefore, question is, do we need an establishment of an implementing authority independent of the federations. I would know.
Yes. In fact, that's a good question. Who's gonna make a choice and say PWD for no on the news TV3?
Yes.
In fact, the National Council of Persons with Disabilities, their plea is that the government should put them on a pedestal of becoming an authority. And if the government is able to do that for them, I bet you things will take effect. Because right now, they are not, it's just a council, right? They are not an authority yet.
Yeah.
But if they become an independent body governing the affairs of persons with disabilities in Ghana, I'm telling you, things will change. There are no implementation authorities around. It will be the open. You just read it clearly. Say, would di mrano soa? When di mrano soa?
Yeah.
There are
Yes, penalties are there.
Penalties are there. But how many have been caught?
Are we punishing them?
Who?
With a said Mrano Kano.
That is the question that I was even asking. Who have we punished? Who? Why? Because the point is so clear. It's so clear. Make it accessible.
Yeah.
Straightforward. In fact, not to say this, but even school I made me call for my first degree. Okay? The school, how much disability program now the term disability the school was not accessible. I told them. You taught us how to ensure that we are doing the right thing. But the school as a knowledge hub, changing lives, making sure that things are working. So school is accessible. So be lecture, not what third floor, lecture not called third floor. The friends has to carry the person on the wheelchair and carry the person up there. What if the Sada not the down for next master me must school and on the boy for intimate fanwa.
And now this lecture say.
So no crampono or kafumo. It's at the end of the day, you didn't do the right thing. Even though you are teaching us. So these are some of the things. They know. But doing it, it becomes a problem.
Why is there a deliberate attempt to ignore the implementation of some of the provisions of this act on the part of agencies, like you mentioned, who should have known better?
Yes. So you see, that is a very fantastic question. On say in Pembe, I am now we expect to be pushed and send a baby. But nipa de send a nyame adomodi nyansa 2-3 you must let it work all the time. And people always see that helping persons with disabilities, is like charity. But the truth of the matter is that se unim pa se dachibi usube some pensiona, you not treat people anyhow. Yes, if you have that in mind, you not treat people anyhow. And then people who are supposed to know better are these able organizations. What are they supposed to do? You know what is right. Roll out excessive and robust awareness raising campaigns. Roll it out. Yem blasting every time. Send your politics every day on TV. People are so in tune to politics. Why? Because people are talking about it.
Yeah, every
it's
day.
Every day affair.
But I don't do that in the morning.
Yes, of course. I know you don't do that. But the point is that every day be a politics, baby.
Yeah.
So we ask, how many times must these information, disability campaigns, rolling out awareness raising, strategic planning and other stuff, how many times are we rolling them out? Is it a year only when it is International Day of Persons with Disabilities? Is it that? That is not enough. It becomes another problem because Sebi, people need to be reminded all the time.
Yeah.
All the time. And Sebi, only a corner no ubiso because me coming say that. Why? Because the organization which is in charge has not raised enough awareness. I bet you a lot of, if you should have a poll on it now, a lot of people will tell you they don't know. In fact, there was a program I attended. There is a bill, there is a law called Destitute Act.
Yeah.
Yes.
Yes.
Now him say it's a crime.
It's a crime, yeah.
Yes.
Yes.
But people don't know.
So it's a crime. Police phone
exactly.
Also mutimicho.
Exactly.
Because you're not supposed to do that. And Obibesi promotes that because the more you do that, the more the person feels that I can always get whatever it is that I want from the roadside.
Fantastic.
Eyemra.
Yes.
Yes.
But people don't know. And to say, Now, bra, asima okay in Ghana is a Christian-based country. So me ya nemwa nyame be shira me na ayesa ukoka pe say hey basa wanya de wo ye ni paboneni wo utumodin on chade adena but they don't know. It's another thing. People are ignorant, but they say ignorant of the law doesn't mean that you are free.
Yes.
On the Internet Disability Act, it is something that has to be all the time. People have to be reminded, especially even people who see that in Krana. There should be an organization. The people who are checking the like I was telling you, the Buildings Constructive Act, the act, the code of ethics for building, it has to be included in it. There should be a portion, especially if it is a social place for people to gather. Restaurant, hospital, schools, whatever it is. It also making sure that there is a ramp. There is something that gives access to
make it
persons
disability friendly.
Exactly.
Do you know, say, oye fiera na obia se be wadi dem ba ofie so obabe pedan ahan adem no wa mano emra no betimi aso pan mu do akwa akogina senibia. Because you are denying the person of a social right.
Yes.
The person has the right for accommodation. Inti oba no kresika no kwa na e wo se odi dan man na wo se odi dan man. But here is the kick. Most landlords do not want to do that.
They won't. They don't. Why? Because they feel like what about their bed in their mommy?
And that brings in the question of societal norms and cultural perception of one more did them. Because that feeds into the stereotype. You did them experience.
Yes.
Because if we change that from the root, then the bit who said they are part of us. They are also expected to have rights.
Yes.
And so those rights will be given them.
Yes.
But oko miyaho duonwa said yehu yenuano mu did them no. Fuels the kind of prejudice and stereotypes are. Where do we begin from when we say I will say it dismantle all of those stereotypes? How can society galvanize to advocate for the cause of persons with disability?
Great. So first, we have to start from the minute part. That is the family. The family itself. And so, like you said, you have to start from somewhere. But say anything that begins, it starts small and it have a ripple effect on others.
Yeah.
And we start from the family. If the family accepts this person with disability, it will transcend.
Okay.
And most families in Ankasa, if there is no education, how do the family even come to accept their own, their very own? Because you go into the into people's houses and they tell you that yes, because the mother is shy of the child.
Yeah,
exactly. And it starts from the family. We have to educate them. Education. How do we change it? Through education, advocacy raising, and awareness campaign. Making sure that we sensitize the community. Into the family, the community, the sub-district, we go, now we have to extend it. Even sometimes we have to use people who have been able to break out and have done massive things in Ghana and abroad to come and speak to the very own people who have persons with disabilities in their homes. Because at the end of the day, I mean, Odowinya, and I'm no Kasi, Akolano, or your codings, on Microsoft in the Yejuma. Yes, Microsoft. And I tell you, Microsoft is now in tune to employ children with autism. Yes, because when they fix their eyes on something, when it is not perfect, they don't leave it.
They won't leave it, yeah.
Yes, unless it is perfect.
Yeah.
Microsoft. It is here in Kwalabisa, that's what they are looking for. And all the time, we bring these kids. Madam, akwale o Ghana yi, nenye sa no not you. Ni mame jini trumu. Ni mame ma expect ebe hwa akwala yi. And I'm so happy to say, by the grace of God, it's me ebo akwala. At the end of the day, no, kaka they introduce akwala called coding. Kaka sa, now the child is in a board. And this child is now a gold. gosika ni nyina ye waya e de fa account ni mu what ma say enti no the stereotype no e te kire ne say oh akwa we di dem die no so man fa so bia wa be bed in dia mame wa be bed in dia mame ai enokre na mom no etu betwa why because wo maame no wo papa no wo na wo se wo ma wani ekọ ba no ho na wo ma wo ba no muwa bia ohia se na be ya akwa ne ba be ne daachi be efe obi wo no ma te se maame ya click foundation Auntie Mary ni be wa so akole ni mu kakaka she the child is an ambassador for Kimpiski. Oh, it's an ambassador brand for a lot of things, hair, weave-ons, other stuffs. The child, but at the end of the day, Sebi, the condition is there, but the mother has been able to support the child to be very, 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 impactful in society. So, that's how we are supposed to go about it: awareness raising, public education.
Awareness raising, public education. Team here, because and I know, sir, your organization, just as you mentioned, say, especially when you realize there is a child who be at what did them provide the potty and among one more did them. Are there some specific initiatives, sir, your organization, mode eba bontine, to help deal with some of the stereotypes, some of the challenges and as a barrier, sir, persons with disability or more facing?
Yeah, it's the organization name Disability and Rehabilitation Association of Ghana, simply in a DARAC.
Okay.
And Jumedi like I mentioned earlier, the CBR, community-based rehabilitation matrix in Ejuma. You share health, education, livelihood, social, and empowerment.
Okay.
And it's an 5 year my boy. And no name Jumedi Edi. Now your programs be pretty so especially the interlands. Your court Bimbela Northern Region. You could raise a campaign. You establish a baby friend Mantambu rehabilitation.
Okay.
Honomo. You call a friend saying Takrade. Almost so you could create another program be no say breaking barriers for inclusive inclusivity. To almost and so and access to healthcare services. You render most of the time screening and then them. And we also have a lot of social skills. A friend is saying go into other related recreational activities. We also support them. Obiso ono mwa sebi ono so no ne de ne nsano dwuma pay dwuma ye and also pay bibisa and also we provide. Say scan kwa ho no mo dia we will help. Na ebiomo so no we render assistive devices. Say wheelchairs and other stuffs. If we have it available, we give it out to people. It those donations no. Na say we don't want the person to be very dependent. And we ensure say bring you on board that we ensure that we are able to ensure that you are self-reliant. How do we do that? We give you skill training. We do an assessment. We check it out. Say, okay, I want to go into agri-tech. Agriculture, about technology account. We have partner organizations. Say, let me introduce you. Then they support you with that. Then we give you seed funding, where you go in, then you start your business. Then we have monitoring all the time. We monitor to ensure, we make sure that your produce is publicly available for buying. We give it to you, we roll it out again. You'll be independent to take care of your family. But all these monies, unfortunately, is coming from our own pocket.
And then can be because all of the initiatives are capital, capital driven. Even free because if you have to provide wheelchairs, for example, and as your assistive programs that you're doing, your social interventions that you're giving to persons with disability, if you don't have the skill set to teach them, you may have to go and bring somebody or what send him dear no exactly. Say be a one for them free encrementemu o go for free etifrimantemu baby your better na konia bedi ni hu nsem ni nyina no yade a eka ewo ho so kwan be na mo fa so a throughout the entire year you are able to embark on all of these initiatives,
right? unfortunately no ne nyinaa fie bottom nti ada yɛ ni sika na kyɛ sɛ yɛntimi nyɛ hwee unfortunately na ayana we are always and now eba ne whole chair na we have a partner organization omo no mboa yɛn kakra
okay
ono no what vetema
okay
right into Johnny and Friends omo no omo it's an international organization into me papa baako friend Reverend Joel Kwansa ono one fantastic man ono na me bia ebo ne din a esi daddy pacho yenkofo yehia ho chairs o se oh nat ma me checking hwe me hwe warehouse o se bi wo ho a ebi wo nko ade a o se oh bra beje na ye de ko just about 3 days ago broni bi free UK ehun yen na ofre me o pese ye interview now guess what the interview is about assistive technology how do we question be say the same question will be say the same question enter eba ne sa na sabi yentimi especially ye djuma no ekọ ekyiri nanso yentimi to bitimi frɛ yɛn de ya kese pa na so we frɛ ne ka say oh onua yenni bi I have a tall list of people on my list but the funding is not there nkofo hia mo awo ukọ baby pa bra wo be ho
na some nim say disability fund adambo
yes but so yes disability fund is for them but ubesi yenka ne kese yenim de akọ adie yi wo amodia nanso obekọbu no yesi yei won enti ne sane mani nyina no ya de kese pa esi akwan but if they are to get it they are to access it anka ebebuom but a lot of them are not able to.
Happy 99 FM Wasukusu no and na International Day of Persons with Disability. Assembly that's one no has got to do with fostering disability inclusive societies for advancing social progress. I say you know no madi dem nyina na ye de omoka edwumadi a ye di ni nyina ho said ye bia mpuntu ni nkoso no ye nya omunso ebitimi enya bi ora Nathaniel Larbi anda and Mene Nutrition Komo, your founder and the chief executive officer of the Disability and Rehabilitation Association of Ghana. Rwanda say for 18 and I know there's a lot of people are listening to us. And especially the gender, children and social protection ministry because I realize the Disability Council is under that particular ministry.
Yes.
If there are niema miensa opese nimu ya no yebetumi aye edi aboa enuanmu a sebi omadi dem no what will be that niema miensa obeka kira ban ne se omomodi an onye nimu ya mfama persons with disability.
Okay, me da se bebre na niema miensa de di kan mesra ban se their health sa national health insurance onye in a way a sebi obi a wedi dem no obetua kana sika kitwebi and in that health na ankasa nso no ye more priorities because my master's research am here is based on health, access to healthcare. That for my master's and the things I found out was extreme ding me sraban so omomodi an onye sade we mom and they told me no skill training, especially war interlands, northern region, they need that skill. They can also go and tally along with their peers. No more with nation development. Number 3, say abwa abino yen organization, Disability and Rehabilitation Association of Ghana.
Because abine to me nyina.
Ontimi nyina. Sene be yen so no be a wase yekono, ebetimi aiden. Yes, we need support from the government. If the government can do us this honor, and we'll be so excited to have the gender and then other disabled organizations to come in and support us with our vision.
We have about 7 minutes to wrap up on the show this morning. Remember 1 minute. What's my chat tour? You didn't come here na me Ghana for muti and so edi enkomo. What would you say?
Okay, so today being an international day for persons with disabilities, like I say, sebi did them more so much skill, and we want to thank them for their contribution to national development. Na ebiomo so no meda fani say mpanyifo mo da sa ekudumeko nyina no ase for the work that they are doing, but we are pleading say they should do more to that. And finally is also to extend goodwill message to the president of our country for the job well done so far, and also hearing the cry and the plea of persons with disabilities, and also supporting their vision. And I feel so that literature can see a pan and say, Abano be as an organization, or no, so no, only I can't saying agenda be home. I and no is in line with persons with disabilities. That is our cry.